many women, whether it's because they're suffering with an illness or want to delay their childbearing for a long period of time, may choose an option we generically call fertility preservation. Recognize that as women get older, so do their eggs, and old eggs don't make babies. And so we want to keep those eggs that are young and healthy something like in suspended animation so that they can be used when necessary or when desired to help a couple conceive or to help a woman conceive, perhaps 10 years after she put them aside to freeze them in that suspended animation. The procedure for preserving one's eggs is very similar to in vitro fertilization, except that there's no fertilization. The eggs are stimulated in a woman's ovaries over the course of approximately 2 weeks with fertility medication, standard variety fertility medication. The eggs are then retrieved in the standard way we do for in vitro fertilization, but not fertilized. Instead, they're frozen in liquid nitrogen in a way that keeps them from aging. Wouldn't it be nice if we could freeze ourselves and keep ourselves from aging? It doesn't work that way, but we can freeze those eggs. They can be frozen for a long time. I don't even think we know how long because the technique hasn't been available that long, but for a long time, then thawed out when a woman is ready to conceive and start her family. Fertility preservation in cancer patients, as important as it is, oftentimes gets overlooked. Once a woman has radiation to her ovaries, if it's a pelvic malignancy, or chemotherapy for breast cancer or other malignancies, it may be too late for fertility preservation. Remember that chemotherapy and radiation are very toxic to both cancer cells and to normal cells. And eggs are particularly sensitive in those settings. We want to make sure that the short period of time between the diagnosis of a cancer and the active treatment with chemotherapy or radiation, that in that brief interval, in that opportunity, that we get those eggs so that she can make decisions about her own fertility down the road, depending upon whether and how she beats that cancer.